obviously, one of the main questions that we get asked as people turn, look to navigate and get closer to 65 and look to transition from what I call traditional healthcare to Medicare is, what's the best place to start, I guess? Where do you go besides calling Scott? What's the next best place to start?
The best place to start really is just understanding, and this is part of your guys' whole retirement plan. A big part of the retirement plan is their Social Security and other benefits that they've paid for their whole life. If you ask me what health insurance costs today, I would say on average, my clients pay about $800 a month for every person that's on health insurance. And that's for a plan that's really not very good right now. $2,000 deductibles, copays, big prescription copays, and what have you. But one thing that most of your clients, if not all of your clients, have done is they've all paid their Medicare taxes, as is their employer, for the last 30, 40 years of their working. And what that gets them at age 65, this does not happen if they start collecting early. That doesn't trigger it. But at age 65 or their Social Security normal retirement age, like for me, I think it's 66 and a half or 67, that gets them access to Medicare Part A. If you think of health insurance and how health insurance has evolved, Part A was the first piece of Medicare, and it essentially covers the big stuff, the hospital stuff. And that's worth about $500 a month. Okay, so the reason why looking at Medicare as opposed to COBRA or your employer plan is because you're getting something for free, and I have air quotes here if you're hearing this on the the radio. You've paid for it. You've paid taxes. Your employer has matched every dollar of that tax since you've been working, and at 65 you get Medicare Part A, and that costs you nothing. And if you do nothing else, Medicare Part A is actually pretty good insurance. It covers the big stuff. If you got cancer, you have a hospital stay, it's going to cover 80% of that bill. Okay? Mm-hmm. Now, health insurance has evolved. We started at MRIs and CAT scans and stuff like that. So now they've created something called Medicare Part B, which you have to choose to elect. And that's the cost of Part B. You buy that from the government, and that is varied based upon your income from 2 years ago. So they look at your tax return from 2 years ago, and then based upon how much money you made, they then charge you a dollar amount for Part B. That, once again, supplements what's on Part A. Then you have the decision, do you want to buy a private plan or not? And 95% of the people we meet with do choose to buy a private plan. There's some incentives to do so, because if you don't, there's penalties later on and what have you. And those can range from $0 a month to $200 a month for a Cadillac plan. Mm-hmm. And the reason why an insurance company can only charge $200 versus the $800 when you were 64 years old is because they're only making up what Part A doesn't cover and what Part B doesn't cover. Do you see what I mean? So, yes. Like, you've worked your whole life for this stuff. When you choose to select your Social Security check, that's a big part of your guys' financial plan. Also, whether you tap into this $500 a month benefit per person, is entirely up to you. And what a lot of people don't realize is they can do it while they're working. They can do it after working. But a lot of people that are working, they might be paying $500 a month for a worse plan than what they have through Medicare.